The BAME Vision logo, 4 solid circles from left to right in colours of brown, tan, coffee and beige, with the words BAME written in white within them, with the word Vision written in tan underneath, and below the words Supporting Ethnically Diverse Communities with Their Eye Health and Sight Loss in brown.
Welcome everyone and thank you for joining us. Today's webinar 2 for the National Eye Health Week series is Myopia and Me. Just to remind everyone that this webinar is recorded. And there will be opportunity to ask your questions to both our professional and lived experience speaker at the end once they finish presenting. So feel free to put it in the chat, raise your hand, or if it's easier, just to unmute and you can comment or ask your question. So I'd like to, I want to introduce myself, sorry. So I'm Bhavini Shah, Chair and Founder of BAME Vision. And I'd like to invite our speaker for today, Bhavin Shah, who is a behavioural expert and a international myopia expert. Bhavin, welcome, and the floor is yours.
Hi there. Thank you very much for the introduction there. Thank you, Bhavini, and for BAME as well for inviting me on talk about this topic. It's very passionate about it. I'm going to just share my screen. And let me just put my presentation on. Bear with me a moment. So I'm Bhavin Shah. I'm a behavioural optometrist. I've been an optometrist for about 26 years, and particularly in the field of myopia management since about 2016, 2017. That's been my kind of real passion, and making a difference. And I'll explain a bit more about what myopia management is. And my practice is based in London, so I've been doing a lot of work with myopes. So firstly, I mean, the best way to start, myopia, what is it? It's the technical term for short-sightedness. That's where you have difficulties when you're trying to look far away without your glasses on. So when you put your glass on, suddenly everything becomes clear. If you take your glass off, you can often see close-up things really clearly. But it's difficulty seeing far away, and usually it tends to start in the teenage years. Sometimes it can start earlier, and then after up till about the age of 18 and 21, there's going to be changes as you age and as you grow. Your eyeball changes and you often become more and more short-sighted during childhood, and then when you reach about 21, it tends to be stable, and it doesn't progress then at that point. So when we're looking at people who are short-sighted, where we're trying to make a difference, it tends to be with kids in childhood when they're actually growing. I'd like to just have a quick poll, or just a quick drop in the chat if you are short-sighted, if you're myopic. Mention it in the chat, because there's going to be a significant proportion of people who are short-sighted. If you take any population, and I'll talk a bit more in a moment. So yeah, feel free to use the chat if you want to say that if you're short-sighted.
If anyone finds it challenging to put something in the chat, then if you feel comfortable to unmute and just say yes, feel free to.
That's right. I'll go on to my next part. One moment. So just actually as an idea of how common it's become, in the last 20 years, the number of people who have myopia in the UK has doubled, and in the UK, looking at 18 to 16 to 18-year-olds, about 32% we believe are now short-sighted and now myopic. And in the Far East, if you look at countries like Korea, Singapore, we're finding 90%, over 90%, and now become short-sighted. And the World Health Organization believes that by 2050, over half of the world's population will be short-sighted. So it's a significant increase, and it is going to put a significant burden on people's eyes and healthcare generally. Why are we kind of so concerned? If you just think, could it be just give someone a pair of glasses and that will give them good vision? So if we have a look at what happens with myopia, now I've got an image on the side here of a normal eyeball. What happens with short-sightedness is when you become myopic, as you grow, the eyeball grows at a slightly faster rate than we expect. So on the lower image here, the eyeball has elongated during the growth period. And what's happened is every time it elongates a little bit, your prescription changes and you need a slightly stronger pair of glasses. So in the old days, we would have thought, when I was growing up, I was given a pair of glasses about the age of 12. And then every year I'd go back and have another eye test, and I need a stronger pair of glasses. And what it would be, oh, your eyes have changed. But actually, what we're finding out now, what's really happening is that my eyeball had grown a little bit bigger. I'll discuss a little bit more about exactly why that's happening in a moment. But what happens is when your eyeball's a bit bigger than average, that means the retina, the film at the back of your eye that senses light, needs to be a little bit stretched out to fit that larger eyeball. When it's stretched out, it becomes thinner and it becomes a little bit weaker. So there's more risk of damage. And one of the most common things that can happen, especially when you have a higher level of short-sightedness, higher level of myopia, you're more likely to have tears in the retina and have retinal detachment. So it's where the retina actually physically starts working its way off the back of the eye. But there's other complications as well. There's an area at the back of the eye called the macula, which is responsible for the really, really clear vision, that the kind of central detailed sight. That's more likely to break down when you're myopic, when you're highly myopic. In fact, what we're finding some countries now, particularly in the Far East, macular damage as a result of myopia is one of the largest causes of blindness in one eye. And other conditions which can be common, but they're more likely to happen when you're short-sighted. So particularly cataract. Everybody gets cataracts eventually, but they may happen at a younger age, and glaucoma may have a higher risk. And what we find, every change in the prescription. So if the prescription changes by one diopter, we have the kind of diopters which we call are the steps of the prescription. So for example, if you go from -3 to -4. Your increase of a serious complication with your eye increases by 40%. So it's quite significant. So some of the factors, why is it actually happening? What's going on here? So if you're short-sighted yourself, then your children are much more likely to be short-sighted. So if there's one parent who's myopic, you're 3 times more likely to be myopic yourself. If you have both parents being myopic, you're 6 times more likely. So that means with every generation, there's going to be an increase in the amount of people being short-sighted. Kids now are spending a lot less time outdoors compared to what they used to. And what we find is sunlight has a very protective effect on the eye. It seems to reduce the risk of the eyeball growing bigger, and whether your sight's affected by short-sightedness. So sunlight, outdoor time is a massive factor. A lot of time doing reading or close-up stuff, like doing close-up work or using devices, particularly the reading. If you're holding something very, very close, you're much more likely to become short-sighted, or much more likely for that short-sightedness to change at a faster rate. If there's not enough sleep, that's going to be a factor. And what we also find is that once you become short-sighted, the eye tries to compensate, but what happens is the only compensation mechanism that it has is to grow a bit bigger. And the optical effect of being short-sightedness, when you become short-sighted, there's an optical effect that happens in the eye. And it happens whether you wear glasses or whether you wear contact lenses. That optical effect around the kind of what we call it the periphery of the eyeball, so the sides of the eyeball and inside, it realizes that it's out of focus, so it tries to help, but all it does is it makes your eyeball grow bigger. And so it becomes almost like a vicious circle. So a vicious cycle, it just keeps going bigger and bigger and bigger during that growth period. Now, some people it may happen at a faster rate, some people it may happen at a slower rate, but it just does keep progressing over that time, which then gives us the risk factors later on in life. And for some kids, it may be that the way their eyes work together, or the way their eyes focus on things close up, may have some effect. So if some kids, that their eyes aren't working so well together, or they're not focusing as well, that may be another driver why things change so much. So just thinking about, what's happening now. Why are we seeing more children who are becoming short-sighted? So some of the kind of facts that we're getting now are that kids are getting 50% less physical activity than kids 20 years ago. So when we were kind of out, we were outdoors a lot more of the time, having lots of physical things than our kids are now. And with each generation, that seems to be changing. I remember being out, on school holidays. We'd have like a green behind my house, and we'd be out there all day, or we'd be on our bikes all day, and then just be coming home in the evening time. Um, Kids are spending a lot of time on devices now. Some estimations are up to 7 hours a day on a screen. Um, which is it's going to have an effect on an eye that's growing. And actually, the lockdown seemed to have a negative impact as well. There was a study in China that was released in 2021, so just after the first lockdowns, and the number of new children who are becoming short-sighted was twice what it was the year before, because kids were stuck indoors, and their school was on a screen in front of them, and they weren't getting there. Even in a classroom, you get some movement going on. You might be looking at the teacher, and you might be looking back at your work, but if you're fixed on the screen all the time, your eyes will adapt. And in fact, short-sightedness is an adaptation to making it easier for you to do close-up work. So what are some of the things, now we know that it's definitely happening, it's definitely being a problem, what are the things we should be looking to implement? So one of the most important things, the easiest things, actually, is getting outside. Children should be having at least 2 hours outdoors every time. Now, we know in the UK, we might say, oh, actually, it's raining, or the weather's not so good. But actually, studies are coming from countries like Norway, which has much colder weather. And those kids are spending more time outdoors than kids in the UK, and their risk of short-sightedness and myopia is much less than it is in the UK. So really, children need to be outside as much as possible. Now, thinking about what they're doing while they're reading, while they're doing close-up things, is going to be really important as well. Changing their habits, changing the way that they interact with books, they interact with devices. Now, there's a few images here. So what the top image shows Lily, who came to see me. Now, she's using what we call the elbow rule. So what you do, you put your elbow, you put your chin, your fist on your chin, and where your elbow is, that's the book should not be any closer than that distance. So that's a really easy way of making sure a book is at the right distance for you. So it shouldn't be any closer than where your elbow is if you put your fist on your chin. Another rule that I use is called the bookmark rule, and you can see in the middle image that Lily is doing that. So what she does, where the next chapter is, she puts her her bookmark there. So she knows when she gets to the bookmark, it's time to take a little break, or it's time to look around a little bit. So if there's lots of pages between the chapter, we can always put it maybe 3 or 4 pages ahead. So we know when we get to the bookmark, it's time to take a break. And just getting really good lighting as well. So a lot of the time, kids are reading in the dark, and the image that we've got at the bottom is a child on a bed. They've put the book on the pillow, and they're lying down on the bed with their head over the book. So automatically you can see that they're too close to the book. They're using a torch in this image, so that there's not enough light there. And all of those things over time will make things get much worse. So make sure there's really good habits, sitting up when reading, making sure it's far away, having really good lighting, and ensuring that you take as many breaks as possible. So everybody always asks me about screen time, and it's there's only no real hard or fast rules, but it's really important to make sure you take breaks. Make sure you're not just fixed on that screen all the time. There is what's called the 20-20-20 rule, which is making sure that every 20 minutes at least you look at something 20 feet away for at least 20 seconds. So, but just having breaks, just relaxing your eyes, particularly if your eyes are focused close up, you need to relax them by looking something far away. You need to avoid devices at least an hour before going to sleep. So the blue light from the screen often will disrupt sleeping patterns. And also the devices nowadays, they're not just devices where you're looking, they're actually very stimulating. So removing that stimulation, as well as helping your eyes, will probably help you sleep better as well. And just thinking about what's appropriate for the child as well. Children under 2 years, even up to 3 years, really they shouldn't be using a screen much at all. When they go from kind of age of 3 or 4, then we can introduce screens, half an hour, maybe an hour maximum in a day, thinking about what they're doing on the screen as well. If they're doing, there's games and activities, which some of them are very good, and actually some kids would benefit from playing educational games for half an hour a day. It's probably maybe better than not using them, just because they their lives are going to be very digital when they grow up. I mean, our lives are getting more digital now anyway. But if you imagine what's going to happen to them when they're older, it's almost everything's going to be based on a screen. So they need to be able to use the screen, but they need to be able to use it in a healthy way, and in a way that's good for their development. I mean, as I said before, kids need to be outside. Using a screen too much has been shown to affect how kids use their motor skills, affect how they use their hands, affect their understanding of visual spatial awareness, their movement, physical activities. So getting outside, doing physical stuff is really, really important. So now the next thing I want to really talk about is management. So what we have now, which unfortunately wasn't available when I was growing up, and when many of us were growing up, is ways to slow down that change. So ways to mean that actually you won't be so short-sighted as an adult, which then would reduce all the risk of all those other complications. And there's some great options which are very, very effective now. Contact lenses, particularly, about 15-20 years ago, there was a study that came out from the Far East where they used special contact lenses which had a special focal point, and children who wore those, their eyes didn't progress as fast as children who weren't wearing, or who were wearing either regular glass or regular contact lenses. And over the few years, they've developed these kind of lenses in order to be able to slow down the rate of change. There's a few that are available on the market that are well known. There's one called MySight, there's one called Natural View, and there's one called Milo, and a few others as well. And they're very effective at slowing down the rate of change. There's and one of the images we've got there is just a design of a lens where it's got a focal point. Remember how I was talking before earlier that the peripheral part of the retina receives a different image. So if we alter the image with a contact lens that where the eye receives that image, we can slow down that rate of change. And we've got lenses which are overnight lenses. They're lenses that the children wear at nighttime. And these work extremely well. They work within a limited range of powers. Children wear them at night. They very gently reshape the front surface of the eye, so that in the morning they take the lenses out, and for the rest of the day they have clear vision. It does almost work like magic. They can see very, very clearly, but the side effect is that also it will slow down the rate of change, so their eyes won't progress. Now, many people say, actually, how can you give contact lenses to children? But children take really, really well with contact lenses. I mean, the youngest that we have is about 4 years old. Now, some children manage it better than others. Some may be more sensitive than others, and we've got to gauge each child individually. But the majority of children who have worn lenses, a good 95% in my practice would prefer them to wearing glasses. There are thankfully some glasses options now for the children who can't wear contact lenses, and we've got lenses now that have a special optical zone again around the periphery of the lens, which has a similar effect to to wearing contact lenses. So we've got options. There's one other option, which is a drops, which have been available in the Far East and Europe and the US for a long time. They're not yet licensed in the UK. They are available in the UK from some ophthalmologists who can offer them on an unlicensed basis. I suspect that the licensing will change probably within the next year or two in the UK, in line with other providers in other countries. So just give you an idea of how these kind of lenses are working. I've got Oliver here. There's a picture of him on the side, which I'll describe in a moment. So he came to see me in 2017, so 7 years ago. He was 7, and his prescription was -3 in both eyes. And his mum came to see me because she knew I was specializing in myopia management at that time. And at that time, there weren't many people at all who were doing it. And they were really concerned because, again, the prescription, every time we went for an eye test, the prescription would just get stronger and stronger. So I'd fitted him with contact lenses at that time. And the picture there is a picture of him wearing contact lenses by himself at the age of 7. And just to give you an idea of what kind of effect it made. So on this slide, there's actually a graph on there which shows at the age of 7, he had a prescription of -3, which on a scale of what we expect for that age, he was much higher than what we expected a child to be at that age. And what we can do is we can roughly work out what we expect his prescription to be as an adult. So we expect his prescription based on what he was at the age of 7. At the age of 20, we would expect him to be a -1150. So a significantly high prescription. His risk for all of those other factors that I discussed earlier, particularly a retinal tear or retinal detachment, would have been something like at least 50%. So it was a 50% chance of having a retinal detachment at that level. So we put him on contact lenses, and now after 7 years, his current prescription is about -4. Without management at this age, according to the graph we've got there, we would expect it to be a -8 by now. So it makes a big difference. So and also wearing contact lenses at his age, he's able to play sports much better, and he's all around a much more confident child. So just wrapping up, I just want to give you a few key takeaways. So if your child is short-sighted, some of the really important things you need to remember: make sure that they have regular sight tests at least once a year. And this is even more important if you're short-sighted yourself as well, because you know that the risk is going to be much higher. You're going to make sure that your child has at least 2 hours outdoors every day. That's going to be really important. At school, thankfully, they do incorporate a lot of time outdoors. So they do try and force the children to be outside during break times and lunch times, and just to see what they're doing. The children who are real bookworms, unfortunately, we don't want to stop them reading, but they are much more likely to become more short-sighted more quickly. So changing their habits, making sure they're taking breaks, holding things further away. It's better to read outdoors in sunlight than it is indoors, and just making sure that they're not doing the things where they're holding things very close to them. And obviously, when they do become, or if they do become short-sighted, it's best to speak to someone who can go through some of the options that are available for them. And obviously, adults, we've got as you become an adult and you're short-sighted, the things you need to think about are going to be different from a child. Once you're an adult, your eyes don't really change so much, which is that's one good thing. They will tend to be very stable. But you do need to make sure you have a regular eye test. That's really important, at least once every 2 years. There's a few symptoms that you need to, if you do have a symptom, you need to have it checked out. A couple of the really important ones. Now, this isn't an exhaustive list. These are just some of the important ones to think about. If you suddenly see new floaters, that's often a symptom of something happening with the retina. Now, 95% of those will be quite normal because everybody will get floaters. A good 80-90% of the population will have floaters. So just being aware, if you see a new photo, you need to have it checked out. Often the chances are there's nothing there, but it still needs to be investigated. If you see any unusual shadows in your vision, like you might have a funny patch or a funny shadow area in your vision, which persists, that needs to be checked out as well, same day. same as floaters. And if you see flashing lights, those three are the most kind of ones to think about. But if there's anything that you feel where there's a change in your vision, then you need to have it investigated. And in the same way as children, we were asking them to change their habits, but we should be having good habits as well, and also demonstrating good habits as well. Taking breaks, making sure computers are set in the right place. We're all addicted to our phones often as well. It's the last thing at night that people look at, or the first thing in the morning. So just think about those things for yourself as well, and that will just kind of help keep your eyes working very well. So that's the main part of the presentation. Thank you very much for listening. And then I'll be here later, and I will be able to answer any questions that people have.
Thank you so much. That was so informative and so useful, and so many things that we don't really think about, and it was just amazing to hear and bring it to this presentation, not just for kids but for adults too. So thank you so much. And yes,
My pleasure.
We'll open up to questions for Bhavin towards the later part of this webinar. I'd now like to invite Ronak, who will talk about his diagnosis and his journey, and a little bit more. Ronak, are you there?
Yep, I'm here. Hello.
Hi, lovely. Do you want to introduce yourself and just share a little bit about you and your diagnosis and your eye condition?
Sure. So, hello everyone. My name is Ronak. I come from Manchester, born and raised in Manchester, and I'm 17 years old. Last year, when I was 16, I had a retinal detachment while I was at summer camp. So, I think usually retinal detachment happens to people who are quite a lot older than I was. I remember being in the eye department and I was always the younger one there, but it happened to me, and I think it can happen to a lot of people who are myopic. So before my retinal detachment, I think I had -9 in both eyes. So I was extremely myopic. I was very short-sighted. So thinking about signs or symptoms that I had that let me know that I had a retinal detachment, the first immediate symptom was a persistent blind spot or like blur or shadow in the bottom left of my vision in my left eye. In hindsight, thinking back, there were lots of new black floaters as well, but I hadn't noticed these. I tend to have floaters anyway, but thinking back, there were a lot of new ones. So having looked this up on Google, I thought this might have been a corneal abrasion, which is a different type of thing, and so it might have healed over time. So I thought I'd leave it for a night and see if it would have healed naturally. The next day, the fuzzy, blurry blind spot had actually taken over much of my central vision. So I felt like I had to get it checked out. So the process of the diagnosis, so I was on camp at the time. So I dialed 111, which is the non-emergency medical help number, and they told me to go see an optician, and then they would check it out and see if I had a corneal abrasion, and if not, I was at risk of a retinal detachment, which is much more serious. So I visited 2 while in Wales, and they both told me to go back to Manchester and get a proper diagnosis from the Manchester Royal Eye Hospital. So that's where I went, and throughout that day, I had a series of tests. Throughout the whole process, by the way, the NHS staff were incredible. I was never extremely worried, obviously, though it was quite a serious situation to be in. They always put me at ease. They were always handled me with care, even though for me and my family at this time, we were quite worried because of what the potential consequence could be. Then after a day of doing tests, a doctor told me that I had a macular off retinal detachment, which I don't think you have to know about, but it was quite serious. I was at risk of losing quite a lot, if not all of the vision in my left eye, if the surgery didn't go perfectly. So onto the surgeries and the treatments. Thankfully, it went really well. I had a buccal surgery, which is essentially where they take a thread and sort of stitch the retina, or stitch around the eye. So the retina, which initially detached and came off, is now reattached to the eye. So it went really well. I was very grateful for the surgeons. They did a great job. Then after that, I had a cycle over a few months of taking various eye drops at various times of the day. Some I took in the mornings and night, some I took in the mornings and night, some I took 4 times a day, and that's carried on for 2, 4, 6 months. After that, I had prophylactic or preventative surgery in my right eye. Because I was myopic, and that was the primary cause, the doctors think, of my retinal detachment, I was just at a greater risk. I was also at a greater risk in my right eye as well. And having done some scans, they saw that I actually had tears in the retina in my right eye, which could have been a precursor to another retinal detachment. So I had a preventative surgery in my right eye as well. And then I had regular checkups about half a year before I was fully discharged from the hospital. So thinking about how my life has changed after my diagnosis. So was there a point where I thought it would affect my studies, being a person who was about to go into sixth form, being a sixth form student now? There was a point when I was very concerned about how it might affect my studies, but thankfully it didn't affect them at all. In fact, it probably had a positive impact. I learned quite a lot of resilience from going through that ordeal, and I think that definitely transferred over to my academics. Just as probably left this a bit late, I am wearing contact lenses now, so that might explain why I'm not wearing glasses, but I do have glasses. Following on from that, thinking about reading. So in 95% of situations, I can read perfectly fine. Sometimes when I have my glasses on and I'm reading at night, my eyes can get a bit tired and they can get blurry. The peripheral vision in my left eye, because of the retinal detachment, it was permanently damaged, although it wasn't very extreme. I still have central vision. My peripheral vision isn't as good as it was before, which can be poor in some situations, but on the whole, my vision is pretty much unchanged. Social situations, I think it had pretty much no effect. I think I came out of that experience with a lot more confidence. Screen time, I'm definitely a lot more careful about my screen time now, especially thinking about Bhavin's talk before. I was definitely guilty of some of the behaviors he talked about. So I'm much more conscious of my screen time, and I'm much more conscious about behaviors that might have worsened my myopia. So any tips or advice that I might give to anyone who goes through this ordeal, whether or not they're young like me or just anyone who has a retinal detachment or might have signs of one. If you ever notice an increase in the black floaters around your eyes, or if you see a blind spot or a dark shadow in your vision, do get it checked and try get it checked as quickly as possible. It could save quite a bit of your vision, I think. And then if you are unfortunate enough to have a retinal detachment, recovery can be difficult in quite a few ways. It can be quite trying going to the hospital or many times over the coming months, and it can be hard keeping track of your eye drops. I remember in my case particularly, I became quite self-conscious over my left eyelid, which after the surgery, it had become quite swollen, and it was swollen for months after that. But I think my only advice for that would be just to remember that there is an end to it, and that you just need to get to the other side and things get better. And it being over a year now since the retinal detachment, I think I can say that it changed me for the better, and I'm almost grateful for the experience. So thank you for listening to me talk about my experience. I'm going to hand back to Bhavini now.
Thank you so much. I'm speechless. I really am. I mean, that was such an empowering speech in what you've experienced. I mean, something which I resonated with was I have retinitis pigmentosa, and I was diagnosed at 17. Was I as eloquently and confident and empowering as you? Hell no, I definitely wasn't. I just felt my world was falling apart, and I couldn't even explain. I think I was in so much denial, and I think the way you've shown, like you said, your resilience, openness, and thank you so much for sharing that. I think you explained that really, really well. Honestly, thank you so much. Yeah, I just want to open up to any questions or comments people may have. Whilst we're waiting for me now to check if there's anything in the chat or any hands raised, I'd like to start off with a question for you, Ronak. Was there any kind of family history, or because you seem as if like you were really clued up, and just wondered if you were aware of retinal detachment or any kind of symptoms or conditions?
Yeah, so, well, about being clued up, I mean, I've spent a lot of time explaining it to people since the retinal detachment happened. Um, so, it seems like part of the package to know a bit about it. So I don't think I have any history of retinal detachment, but
Mhm.
in my family, but I do have quite a long history of myopia and astigmatism, which is, you know, to anyone who doesn't know, I think it's when your eye, you can sort of think of it as a globe, but someone with astigmatism, it gradually becomes flatter and more shaped like a rugby ball. So, and that contributes to myopia. So I had a history of that in my family, and that passed on to me. And so I think I was just naturally more at risk to retinal detachment than most people.
Yeah, thank you. Mino, is there anything in the chat so far?
Yes, so there's a question here from Neil. I believe it's aimed at Bhavin. Why are the numbers so high in the wider world? I think when you're giving the figures about myopia.
Yeah. So there's so firstly you've got the generational changes. So each generation is going to be more short-sighted than the generation before. And then some of the other factors that particularly the kids aren't getting outdoors as much as they used to, and a lot of their worlds are much closer than they were, and that seems to be a really big factor, especially in the Far East, because they did they've done quite a few studies, and kids are spending significantly less, at least an hour less outdoors each day in the Far East than they would in the West. So that they believe is a really, really significant factor.
And we've got another question from Eamon. Are contact lenses free on the NHS for kids, or is that not funded under the GOS contract?
Yeah, so at the moment it's not funded under the GOS contract. It's a very difficult. I mean, it's a very common question. It's very difficult at the moment that the NHS is trying to cope with managing disease as it happens. So when it comes to kind of preventative measures, it's very difficult for them to kind of implement at the moment. But we're trying to see if there's a way of putting it into a contract. But I think that's going to be many years away before that's done.
And he also commented, is it just me, or does everybody else get mixed up with the meaning
Yes,
of
it's very,
short-sighted and long-sighted?
Yeah, it's very common. So the way to describe it is it describes what you can see, not what you can't see. So short-sightedness means you can see at a short distance without glasses, and long-sighted is where you can see better at a long distance without glasses.
Mm.
Okay, and there is a question here from Jayshree. Are there any websites that we can check for more resources as parents on myopia management?
Yes, I'll put some in the chat there. There's a there's a group called Myopia Focus who are providing independent information. I've got information on my website as well, so I'll put that into the link as well. And there's a few other another website called Myopia Profile, which again is another independent one, and they'll have some information on there. I'll just type that into the link now, actually.
Yeah, feel free to put it in the chat. And for anyone who is not able to access the chat for any reason, don't worry, because we'll send all of the information, links and resources along with the recording later on, probably later on this month, actually, if I'm honest. So after all the webinars are completed, we'll share the links to the recordings and all of the information relating to per webinar.
There's no further questions on the chat at the moment.
Thank you. Does anyone wish to ask a question by raising their hand or just unmuting or perhaps commenting?
Bhavin, hi, it's Eamon here. I'll put my camera on if that's all right.
Yeah.
So just, I mean, in the absence of any other questions, I just thought I'd ask something. I have, since being very young, after I had an operation on my left eye, because you can see I've got a kind of strabismus. So, you know, I have no depth perception really. which makes it very funny when I play football or anything to do with balls. I can't.
Yeah.
can't do
Do you play regularly?
Sorry?
Do you play
No,
regularly?
with my
Yeah.
son, I sort of play, but he sort of laughs at me when I'm not very good at seeing where the ball's going to end up. So I kind of tend to be in the wrong place. So, same with cricket's hilarious. Badminton's even funnier because it's shuttlecock. I just, yeah. So I don't really do much in the way of those sorts of sports. But as well as that, I've got in one eye I'm long-sighted and one eye I'm short-sighted. So when I was growing up, I had an awful lot of problems with like difficulty in kind of having a coherent sort of field of vision and being able to kind of comfortably see what I was doing because I was constantly having to readjust.
Yes.
And funnily enough, now I don't know whether this is true or not, but so I do wear glasses and when I went to my last eye test at local Specsavers, they said that my vision had improved in my right eye. And because they were comparing the two, and I've been to the same place, so it was the same, comparing the two readings. And they said that's really weird. And they asked me had I had anything going on with my eyes recently, and I had a sty. And the optometrist said that in rare occasions, having a sty can change the shape of your eyeball.
It can, yeah.
And that can alter, your vision. But it's actually improved it. So.
Yes.
So having a sty is not always a bad thing. So
yeah. What it actually, so what Ronak was talking earlier about astigmatism is when the eyeball's not perfectly spherical.
Yeah.
Now, so what happens, it can have a bit of a curvature in one direction. Now, if you happen to be having the pressing in the opposite direction, it might neutralize it a little bit sometimes.
So that was right. I was a bit scared. I've never heard that before.
So that may have occurred. But so I've just seen a question in the chat about behavioral optometry. I don't know if you've heard of that before. So behavioral optometry looks at the way we understand the space around us and the way we interact with the space and balls and the way we kind of coordinate ourselves to the world. And that's what we actually, as a behavioral optometrist, that's what I look to train people with in order to improve some of those skills, particularly if there's strabismus. We try and get the eyes better aligned, better working together in order to do those. So it's kind of doing it's kind of brain training and developmental training. So we kind of recreate what should have happened to get your eyes, what would have happened when you were young, to learn how balls would move at a particular speed or where they should end up and how we anticipate that. And through practice, we kind of rebuild those connections to be able to do some of those activities. So it's still possible to be doing things to improve that.
Right. I'll look into that. Thanks.
We've had a question from Facebook, a message to me. Is myopia most commonly developed in younger age, or can adults over 30 develop it too?
It's very rare, extremely rare. So the kind of normal type of myopia where it's to do with the eyeball changing, it's a childhood issue, childhood kind of disease. If it's happening later on, it needs to be investigated as to why things are changing.
And am I assuming then, as a child, teenager, and if it's not looked into, that it could potentially lead to further complications as you get older?
Yeah, well, as getting on at a later age, you mean? Yeah, I think it needs to be investigated as to what's happening and what the causes are, and finding out why it's changing. So some things can be sometimes cataracts. Can cause a myopic shift in the eye, or there can be other changes that may be happening with the eye. So we'd want to know what's going on there, really.
Bhavin, there's a question in the chat for you. Would wearing glasses on a regular basis improve myopia?
It all depends on what the prescription is. At certain prescriptions, if you're wearing something for myopia management, then they need to be worn all the time, really, to get to kind of get the effect of them slowing down the rate of change. If you're not getting myopia management, it depends on your vision. The glass themselves are not going to have an impact. So a regular glass, I should say, are not going to have an impact on whether it's going to improve it or change anything. It will just make the vision clear. But if we have lenses that are more the specialist lenses to manage the myopia, that will make a difference if they're worn on a regular basis.
I've got a question only because been I've been told this, and I speak to quite a lot of people, especially from different cultures and backgrounds. So, are there any kind of exercise, like you hear quite a lot of things by doing certain things that could improve your numbers and prevent you from wearing glasses? So, for example, like
it's an interesting, very interesting question, actually. So the evidence says that there's not.
Okay.
Right. However, normally when I look at a child, do an assessment, I will just check how their eyes are focusing and how they're working together. And if there's a difficulty there, I'd normally try and treat that. I'll try and give them exercises for that. Now, whether or not it's making a difference to the myopia, we don't know. I do have a story of some twins that I this is many years ago, it's kind of 2016, where one had a difficulty with the way that his eyes was working together. So basically he'd lose coordination. So when he was reading, for example, he would go from the end of one line to the other and miss a line or miss words out. His twin, who had a similar kind of prescription, didn't have this to the same degree. So the one who had this happening, I did an exercise program over the space of a few months, and it improved the way he reads and improved his kind of academic ability at school through improving his vision. But his eyes changed at a much slower rate than his twin did. So whether or not that is only a study of 2 kids, so it's not a valid scientific study, but actually did seem to me something may be going on there, something that may be worth looking further into.
Yeah, interesting. I've had sorry, I'll go to is there anything in the chat, Minnow?
No, nothing further.
There's a question about Stellest. Yes, a Stellest. There's 2 types. Stellest seems to be working very well in terms of slowing down the rate of change. There's 2 on the market at the moment that there's a couple of others that are due to come onto the market soon. So they do slow down the rate of change compared to regular glass. Well, there's a bit less evidence because only in terms of they've had maybe 2 or 3 years worth of studies, and then they've been launched onto the market. So they do work, but we're still seeing, there's some ages it may work better than other ages, or in terms of these type of lenses. But at least there's an option. It's better to put them in those type of lenses than put them into nothing.
Yeah, I've had a message come through for Ronak, but maybe it could be for both of you. Is there a risk of your retina detaching if it's already detached to once? Like, is there a limit to how many operations one can have?
There is a risk that it could happen again. They do, when it's been checked, they do try and check it. What can happen is, so one part of the retina might have a tear, but if the retina is generally quite thin, there's always a potential risk that there may be a tear elsewhere as well. So I do have a few patients who had one treated, went back after a couple of weeks, and then they found another tear at a different part of the eye that needed treating. And they're assuming that happened within the space of a couple of weeks.
Right. Okay. And you mentioned something about floaters, blind spots. I mean, are you okay just to explain that for anyone that may not know what they are?
Yeah, so a floater, particularly in your field of view, you may suddenly see like a little dots or something that looks like a mosquito or a fly flying, and you look at it and you look for it, and then it's gone. And when you try and look at it, it will move away or float away. And what that is, inside the eyeball, there's like a bag of jelly, and you can sometimes get little lumps of jelly that swim around in there, and they make little shadows on the back of the eye. You'd see it more if you're looking at, say, a white wall that's been lit by sunlight, and then you suddenly see these little things moving. So particularly if you had a retinal tear, you'll see lots of little dots, almost like it's raining, but you're indoors. So that's floaters. Or you may see a strand, or you may see a blob. That they can vary from person to person. And a shadow in your vision may just be like a little patch in your vision, which doesn't look quite right. And so what would happen with the floater, as you move your eye, the floater will float off, or it'll move off. But some it could be like a fixed point, like a fixed little shadow or big shadow or like a patch in your vision. You look around and that kind of moves with you as well. Or sometimes people may also notice, I should have mentioned earlier, it's like a curtain has begun to close on the eye slightly. It's either bottom or from the top. So that's a really important sign as well. So if it's something that looks like a curtain closing, that again needs to be investigated immediately, same day.
There's a question on the chat from Jayshree. When you talked about night lenses, are the lenses soft or hard?
So the night lenses are rigid. So they used to be called hard lenses, but they're not hard. They're actually rigid. They've got a tiny bit of flexibility, but they need to be rigid because what you're doing is very gently. You're just reshaping the front surface of the eye, very, very gently overnight, and just enough so it neutralizes the short-sightedness. And then when you take them out, it stays that shape for the rest of the day, which means your vision for when you're short-sighted gets neutralized for the day.
And Mary is asking, is it similar to diabetic retinopathy?
Yes and no. Diabetic retinopathy tends not to have many symptoms until it's quite advanced. So advanced diabetic retinopathy, yes, you will get these patches in your vision. In the early stages, you may not notice anything. So if you're diabetic, you should be having an annual screening done, and that's across the country, and they're very effective at slowing down the rate of diabetic related problems. I mean, in the kind of past 20 years, maybe the last 10, 15 years since they've implemented this national scheme, I barely see any real diabetic retinopathy now because it gets picked up early, and in most of the early cases, even in the mid kind of moderate cases, it can be reversed with diabetic retinopathy just by monitoring the sugar levels. So thankfully something we don't see as often as we used to.
Yeah.
Jayshree's put up here that she I had a friend said that her doctor injected a small air bubble into her eye when she had retinal detachment. Could that be true?
Yes, it's probably a gas bubble. So what happens is, remember that there's a picture of the eyeball and the retina is like a layer there, and what happens is you get a tear in the retina, then fluid gets underneath, and it causes the retina at that point to peel off. And once it peels off, it's really difficult to fix it again. Now, if you increase the pressure in the eye, it pushes the retina back onto the eyeball as well. So they'll use some kind of substance. So it will either be gas or it may be oil, or like a silicone oil that will increase the pressure and keep the retina back onto the eye and allow it to kind of heal up again or allow it to be fixed back onto the eye again. So that's a very common way of preventing detachments.
Does anyone wish to unmute and ask a question or comment?
Hi, Bhavini, it's Renu here. I've got a couple of questions to ask.
Hi, go ahead.
First of all, I wanted to just say amazing job to Ronak. I think that was very as inspirational, even as for myself at my old age. I think that was amazing from him. And question to Bhavin. Thank you for your presentation.
Pleasure.
As a professional, how would you explain what the macula is and what the retina is to a patient if they ask you?
Yes,
There's a couple of
ways. So normally, if I see a patient, I would have normally done some images. I've taken some images, so I'll normally demonstrate through the images. So you've got an eyeball. On the inside layer of the eyeball is a very thin film, and that's the film that collects light. It's almost like a film in a camera, and that's the retina. And then what happens is that film there's a particular portion of that film where the light normally focuses on, and that's the area that has the very fine detail of vision. Our visual system actually has a tiny area which is clear, and the rest around the periphery, which is slightly blurry. And our eyes point at where we want to look at, and it points the clear vision onto that. Now that clear area of clear vision is called on the retina. It's called the macula. So there's more fibers which detect light in a much finer detail than anywhere else on the eyeball. So I'd normally kind of show them that area. What happens is, unfortunately, with age, that area of the macula is more likely to break down, and more likely to cause issues later on in life. So that's usually how I would explain to kind of patients. So I'd explain, and I'll probably just show them where their own retina is and where their own macula is, as a way of demonstrating it.
And if in the case that they can't see those images because they have lost quite a lot of their central vision, how would you then describe it? I'm sorry, I'm not being difficult here.
Yeah, no, that's fine. So I mean, I would normally, I mean, I can describe it just by kind of talking about it as well. I do keep a couple of model eyes as well. So if they want to feel a model eye, they can feel a model eye. But normally, they have a good idea of what an eyeball should be like, and aware that there's a layer which is like a camera film, or which is like a sensitive layer which detects the light.
Right. Okay.
So
That's
in
great.
the same way that I'm kind of describing to you, I'd normally kind of describe to them. I mean, we do get people who have those kind of difficulties, and you know, it's good to, if they understand what's happening to their own vision, it does give them a bit more empowerment, really, as to understanding what things they can do to help themselves.
Absolutely. And the other question, so just a quick one for myself. So I've got a chromatopsia, and myopia is part of the condition.
Right.
And I had an appointment with my optician recently, and I have to wear, basically, as you can imagine, sunglasses all day long.
Yeah.
And they got a long distance prescription in them.
Yeah.
But the distance, obviously, what I can see is long distance. But I have to often keep putting them up if I need to read something up close.
Yeah.
And I had asked if I could get reading glasses, but my optician said, not at the moment I would prescribe you reading glasses, but I find that I struggle with now reading up close. What would you recommend?
I mean, there's a couple of things that I mean, I may recommend reading glasses, because sometimes that for some people it just makes it easier. It's less effort, or it may just give them that just a little bit of magnification, just enough to make it easier. So I would probably look at maybe reading glass, or just trying some out there. They may be able to just put some lenses on, you get like those trial frames where they put the lenses in. They may be able to put a couple of lenses of what it would look like with reading glasses.
He did do that, and it didn't make much of a difference because of probably the chromatopsia.
Okay.
So he just said maybe try. He said maybe. He goes, but he goes, I don't think he was adamant that I didn't need them, but I just feeling that
have you tried a magnifier?
Yes, again, that doesn't work either.
No, okay. But if you push it, you're saying if you push your glasses up, that helps.
Yeah, but I'm noticing that I'm going a bit more closer and closer to if I'm reading a document. But I had to keep putting my long prescription sunglasses up to read. Now I notice more and more.
Right. Okay.
Whereas before I didn't as much. I could still read with them from a distance, but from a certain distance, which is for me it's arm's length distance.
Yeah.
But now it's like I'm finding that I'm struggling. I have to put them up, but then I'm coming in closer and closer. So, like you mentioned earlier in your presentation, that could obviously affect the myopia in the long term. So I just thought if there's any other suggestions or recommendations, don't really.
No, I mean, I think it would be worthwhile just trying a few other optical aids and seeing if there is a prescription that might work for reading, really. That's the main thing I could recommend, really, in that case. I mean, other aids would be, you can sometimes get kind of little cameras that will give you a bit more magnification and then project it on something like that, possibly. Or devices that will scan and allow you to read. But I would probably double check in terms of if it's possible to modify the prescription in any way.
Sure. Yeah, that's great. Thank you so much.
I hope that was useful. Anything else, Minal?
No, nothing at the moment.
No. Anyone else want to comment?
Yeah. Could I ask a quick question, please?
Sure, Anjani. Hi.
Hi. You mentioned about sunlight, and I'm really impressed with the fact that you said it's important, because I've heard a few times where some advice has been that one should wear sunglasses and try and, especially if you've got problems with your eyes, to protect the eye. Would you differentiate why somebody would say it's advisable to wear sunglasses and to protect your eyes when sunlight is extremely important?
It's a slight contradiction, isn't it?
Yeah.
The high end of UV of sunlight could have a damaging effect, but the kind of blue end, the violet end, has a protective effect on the eye. So you actually got both things going on at the same time. So I think it's a question of kind of balancing out as to what kind of sunlight there is. If you're spending a lot of time, actually, there probably is some benefit in having some kind of UV protection on your eyes. What they're finding, actually, the UV protection from a sunglass lens probably lets in enough sunlight in terms of the kind of blue part of the wavelength, so that you are getting enough of it. That's the kind of what the current studies are saying at the moment. But yeah, no, I understand that too much UV will cause you problems with your eyes later on in life as well. So it is both things going on at the same time. If you're in certain areas, if you're at very high altitude, you can actually literally get sunburn on your eyes from the UV from the sun. So I think it's kind of getting the right balance on that, and some people are more sensitive to light than others. So some kids will feel it more than others, but the kind of studies are showing that enough light will come through even if you're wearing sunglasses.
Right, because in the UK we don't. I can understand that if you. Am I muted?
No, it's
Very sorry. Yeah, it was more that if you're looking at the snow or on a very sunny day in the sea, then yes. But I would have thought,
on a day-to-day basis, for like, if it's an hour or two, it's probably going to be less of an issue.
Yeah, and it's probably healthier to get some sunshine.
Yeah.
Thank you.
very interesting. Great question.
Yeah, it's a very good question. It is a contradiction.
Yeah. Anybody else? Probably got time for a couple more questions.
Can I ask a question, please?
Of course you can.
Yeah. Okay. What happened was that last year in August, I had a cataract surgery on my right eye. And since then, things have gone wrong. Now, beginning, I was having a lot of blurred vision. And every time they kept giving me different drops. And it went on for a few months. And eventually it was getting worse. So I went to see someone private about it. And I was taken into the hospital under the hospital care. I've been receiving treatment, and they gave me 3 injections in my right eye. Things were improving, but suddenly my vision is going backwards again. And they said there's a possibility that there's a fluid being discharged in the back of the eye. And the conclusion from the hospital was that at the time of the cataract, there's a possibility that they've used excessive force, and that has damaged my retina. Now, partly I'm diabetic, but my diabetes has always been under control, and I've always been for eye checkups all the time, and there was no issues at all raised. So what do I do now? I'm stuck and I can't wear glasses. And the hospital said that I can't have my glasses until my eye settles down.
Yeah, sorry to hear that that's happened. It's a very difficult. I think it's very rare for having a complication with a cataract operation, but it does happen sometimes, especially fluid at the back of the eye. I think have they given you a contact? When are they going to see you again?
Well, actually, I was meant to be seen today, but then yesterday I had a phone call from the hospital to say that my appointment has been cancelled and they'll send me another one. So now this thing has been going on. Every 4 to 6 weeks, they see me. Initially, they thought they will discharge me, but on that eye examination with the scan and everything, the fluid retention has started again. And
Yeah.
there are good days and bad days, and my vision gets blurred as well. So I'm totally stuck at the moment. I just don't know which way to turn as well, or who to go to for help as well.
I mean, I think they will need to have a look at as soon as possible, really, to see what's happened with the fluid, and kind of monitor that first before doing anything else. Because I mean, even trying to get glasses, it will vary from day to day if the fluid is changing. Yeah, I think is there any way you can contact the hospital?
Yes, that I can contact the hospital, but the thing is, my issue is that even if they keep giving me drops now, is the damage permanent, or is there any chances of recovery, or what's going to happen to my eyesight in future?
Yeah, it's impossible to know. I mean, they will know because they've done all the scans. So the only one they can help you with that would be them, because they'll know what's happened to the retina, and they'll know what's happened with the fluid. It can improve, but they'll be the ones to be able to tell you that, once they've actually seen what's happened and what's happened either in the past and what's happening in the future.
Is that Bharat uncle?
Sorry?
Is that Bharat uncle speaking?
No, Narendra.
It's Narendra.
Narendra Luka.
Just wanted to ask maybe Jayshree Renu from an ECLO point of view. Is there anything you guys can suggest?
I was just going to come in there, Bhavini, as you know from the ECLO side. I was just going to ask Narendra, what hospital are you with for starters?
Leicester Royal Infirmary.
Leicester Royal. Jayshree, I don't know if you know an ECLO there, but we're happy to have a look into it and give you the details, Bhavini.
Yeah, that would be great. Anything to help.
Yeah, I think point of contact will probably be an eye care liaison officer, because we can often, if a patient feels that they've got an urgent concern, we can often speak to the eye clinic team and raise the concerns and advocate on their behalf. So it's something that we can do. So we'll find out and we'll let you know, Bhavini.
Yeah, that would be amazing, and I can share that with you, Narendra Bhai.
Yeah, I've actually raised these concerns with the doctors and the consultant as to where do I go from here. And basically what it is that, okay, I know I'm not the only patient there to see so many patients, but it's difficult for me as well because I'm not making real good progress on the situation as such.
Yeah. Leave it with us, and we'll see if we can find another contact to try and help you, because we can hear the stress in your voice, and I'm sure it is very stressful. So let's see what we can do, and hopefully if we can, I'll be in touch and we'll get you a contact.
Okay, thanks very much for it. Thank you.
Urmila's asked a question on the chat. Are there any foods to help support vision?
But I think having a healthy diet is really, really important. Drink lots of water. Foods wise, anything with lots of color, particularly fresh fruit and vegetables with color, is really, really important. Peppers, kale, spinach, that kind of thing is really, really important. Blueberries, bilberries are great. It's that pigment that is a very good antioxidant for the back of the eye. So there are supplements that are available as well, over the counter. There's some like Macu Shield, it's called, which is very good for the macula. But having a good diet is really, really important.
And we'll be doing a specific webinar next Thursday, Live Well, See Well, which will cover diet and nutrition in a little bit more detail. So do join that one.
Bhavini, I think the next one's for you. Mary's asking, how can I become a BAME Vision member?
So we don't have membership as such, but you are on our mailing list. So any kind of future webinars, blogs, resources that we produce, you'll get notified just by providing your email address. So any future things that we do, any recordings and things like that, you will automatically receive them until you send us an email, stop sending me stuff. So we don't have members as such, but you're already on our mailing list. I hope that makes sense. Anyone else?
Nothing further at the moment.
No. Okay, so we'll give it a couple of minutes just to make sure that there's nobody who hasn't had the opportunity to ask a question or comment on anything. Whilst we wait, just sort of share next week's webinar. So I think I mentioned earlier, Tuesday, we have got Eye on Mental Health. And then next Thursday, we've got Live Well, See Well. The following Tuesday, which is the 26th of September, that's Driving and Your Vision. And then the last webinar in the National Eye Health Week series, the sixth and final one, is about digital eye care, which will cover screen time, dry eyes, eye drops, and the correct way of putting your eye drops in for people who may be vision impaired as well, finding out the right way to put your eye drops in, as well as for people who may not be vision impaired. Sorry, I can't get my words out right now. So they're the remaining 4 webinars coming up. So I'm just going to quickly check that we're not missing anything in the chat or a hand that's raised.
Can you hear me?
Yes, we can.
Hello, it's Barbara.
Hi, Barbara.
Oh, can I ask a question now?
Of course you can.
Sorry, I'm having a problem with my telephone. I don't know if you can hear me.
Yes, we can.
Oh, you can. Okay. Sorry. Can I ask a question?
Mm-hmm. Yeah,
okay.
go ahead.
I've been following a method called the Bates method of eye exercising for about 2 years now for my myopia. What do you think about that method? For reversing myopia?
Yeah, I mean, they have all these claims. I've never seen it ever work. People claim it does, and I tell them I'm happy to see them before and happy to see them afterwards. But I mean, for some of the things for children may help slow down the rate of change, but again, it's not scientifically proven. So it's very, very anecdotal. And even with the some of the kind of treatment that I think some of the things that they do, they get you to appreciate what your vision is like, so that the kind of focus is the same, but it feels better in terms of vision. So the prescription hasn't changed, but actually you can manage what your vision looks like with a less strong pair of glasses, or with wearing no glasses, even though actually the prescription hasn't changed. I think that happens sometimes. So in some ways, that there may be some benefits of that, but I've never seen it really make a prescription change before.
Right. Okay.
Also, partly the prescription.
Right. So I'm quite high myopia, and I've had some great concerns, and everything that has been said this evening has been very beneficial. But I was looking at this Bates method to see if it will. I've been doing eye exercises, but it doesn't seem to be doing much. But they say it does help a lot to relax the eyes.
Yeah, I mean what kind of things have you done, like active focus or palming and all this kind of thing?
Yeah, the palming a lot. I do the palming a lot. Doing
so the palming actually applies a bit of heat to your eyes, which sometimes improves tear production for some people.
Yeah, because I've got very dry eyes. Does dry eyes relate to high myopia?
No, they're kind of two independent things. But palming sometimes improves because the heat can sometimes make the oils go a bit more liquid and flow better, in theory. And some of the movement things that they do may help your eye movements. I've not yet seen it change myopia itself. And what I do when I'm checking kids with myopia, I'll measure their eyeball length. So that's how I'll measure what's changing is I'll check their eyeball length on every visit, so I know what's changed on there. So you can't grow backwards. You can't change your shoe size in the opposite direction. It only goes in one direction. But there's no harm in doing it. It's just I don't think there's going to be I think it was not going to reduce the prescription as such.
I'm a -15, so I'm very, very high, and I keep getting this every time I go to see my eye consultant that I'm a complex case and to expect a retina detachment. And I'm just concerned, how long do you have before you have to see somebody before you have a retinal detachment? I haven't had one yet, but they're telling me that to expect it.
They won't do anything until it actually happens. So those things you've got to look out for.
I know, yeah, but how long does it? I mean, when it happens, how long do you have before it?
Well, I mean, it's as soon as you get the symptoms, you need to go the same day. Or you need to contact someone the same day. You may have a bit of time, but you need to contact someone the same day.
Okay. Thank you.
Thank you for your question. Quick last check in the chat.
No, nothing so far.
Okay.
Bhavini, it's Renu again. Sorry.
Hi. That's okay.
Can't stop when I start. Hang on. Just going back to somebody who was talking about the UV and looking at the sunlight. Just wanted to make a comment that there are shields with which have different kind of lens that can help with, obviously. Sorry, I can't get my words out today, so I'll be on the phone all day. Can help with reducing the sunlight, the UV rays coming in, but also being able to get that sunlight in, if that makes sense. So getting that right amount, but using different color shields like red, green, orange, blue, yellow. So it might be an idea to try some shields over regular glasses. So you've got a balance of both.
Or a cap.
Those caps, like sport caps as well.
Yeah,
which have the
or something with a peak
to it.
Yeah, even a hat with a peak may cut out enough of the direct sunlight, but still allow sunlight to come through.
Some in as well, yeah. So it's usually like a low vision aids, we would call them, to support with getting a bit of both in.
Yeah, thank you for sharing that, Renu. Thank you.
No problem.
Great. Thank you so much to our speakers, both Bhavin and Ronak. I think you both have done an excellent job, very informative. And Ronak, that was really, I just can't get over your speech. It was just so amazing, like especially at a young age, and so positive, you know, for what you've been through and your outlook on life. And yeah, wish you all the best. And just want to say thank you for speaking to everyone and us here today. I would like to launch a poll, and if you're able to complete it, that will really be helpful. If we can launch the poll, it just helps us with future webinars, future activities, and to see where we can improve, and feedback always helps. So if you're able to, we would really appreciate if you can take the time to just complete this very short poll. I think it's only got 6 questions.
It should be on everyone's screens now.
Hi, it's Eamon here. Just looking at the poll, you know, question 6, it says untitled question, single choice, and it's got 2 different options, choice 1 and choice 2. Oh. What does that? Does that mean? Oh, maybe that's something that you haven't actually filled out, so that's an optional question to put in.
Yeah, I apologize. I think question 6 is in there in error.
Oh, that's okay. I thought I was going. I thought I was like,
no, thank you for raising that. Thank you.
But it's not just me then. It's been a long day, and I'm thinking, yes, no, thanks for that. Right, great.
No, thank you. Yeah, so I hope you've enjoyed our first 2 webinars for this week. If you've joined both of them, this one or sorry, just this one. Hope you found them useful, and if you haven't yet registered for next week's webinars and would like to, just send us an email and we can share the links with you. So again, next Tuesday and Thursday at the same time of 7 p.m. Eye on Mental Health Tuesday and Live Well, See Well on Thursday. Thank you so much for joining us, and thank you to our speakers once again. We hope you have a lovely rest of your evening, and thank you for joining us today.
Thank you, everybody. It's brilliant.
Thank you.
As usual.